Hi everybody, it's Dr. B here with Bellissima Dental Boutique, and today we're going to be discussing dental implants. So what are dental implants? A dental implant is a screw, a titanium screw that we either place in your upper jaw or lower jaw. We're able to attach a single unit crown, a bridge, or even an entire arch of teeth known as a denture or a hybrid denture. Dental implants are a great option for people that are missing one tooth or an entire arch. So the advantages of having an implant versus other tooth replacement options such as a bridge or partial. When you have a bridge, so say you extract a tooth and you need to replace it and the dentist gives you a bridge option. The issue with the bridge is that it actually affects more than just the site where the tooth has been extracted. It affects the neighboring teeth. Teeth that may not have any disease, they may have no reason to be restored. So now trying to fix one problem, we've now impacted two additional teeth. When you're using a partial, the partial doesn't help you maintain your bone, and therefore over time, you will have shifts in your teeth. You may need to have new partials. You may end up losing some additional teeth because there's nothing in that bone that helps stabilize the bone and prevents it from receding. Dental implants are a great option because by placing a dental implant in your jaw, we're actually able to help maintain the bone, preventing it from shrinking or atrophying, meaning that you're able to keep your facial form. You don't have this sunken in appearance. Your teeth aren't shifting. You're able to smile with confidence. You're not worried about dentures falling out when you laugh or talk. It actually is a great tooth replacement option. It affects only the site where you're missing teeth. So if you're only missing one side tooth, we're not trying to affect the whole arch. All we're doing is replacing that one area where you're missing your teeth. And I think that it's a great option for people that have great bone, they have great oral hygiene, they're young, or even people that have dentures that are ill-fitting and they want a snugger fit. It can give you the ability to eat foods that you love without worrying about, I can't eat this, I can't eat in public, I gotta take my denture out. It's an excellent tooth replacement option. So let's get into the process of what it looks like to go through and have an implant placed. First things first is always our consultation before we start any major procedure. We want to sit with you. We want to talk to you about what is going on, what you're trying to achieve. Implants and an implant procedure is actually a prosthetic or restorative procedure with a surgical component, meaning that we have to treatment plan with the end in mind. Is the end in mind to give you a bridge? Is the end in mind to give you just to replace one single tooth and you have an implant-supported single unit crown? Is the end in mind to give you a full upper and lower denture? That's how we have to start, and then we can treatment plan backwards. We're going to make sure that your mouth is clean. We want to do a full comprehensive exam. We want to take x-rays. We're going to take a cone beam CT to make sure that we have enough bone that we can place the implant, making sure we don't need to do any bone grafts, sinus lifts, whatever that could compromise your implant placement. We want to make sure that we really address those things first. After we have that consultation, a lot of times will work with our oral surgeon who's here in office, and we will plan your implant. We will go into our 3D software, we place the implant, 3D print your surgical guide in office, and then we're ready to schedule you for your implant placement. The day of the surgery, we want you to be comfortable, wear loose-fitting clothes. For a procedure like this, we do offer several options. So you don't have to do this just under local anesthetic where we just go in and numb you with like lidocaine. That's always an option, but we can also give you oral sedation or IV sedation accompanied with nitrous to make you as comfortable as possible. We know that this process is scary and can be a little nerve-wracking, and we want you to be comfortable and know that you're in good hands. When it comes to the actual implant procedure, sometimes it is done in stages. If we need to remove an old failing implant, if we need to remove a root canal tooth that's broken or another broken tooth, sometimes we have to have a surgical procedure first to remove the implant or remove that broken tooth. We may have to bone graft, you may have to heal, and then come back for an additional surgery to place the implant. For most people, we try to be able to place the implant at the same time if we're able to. So if we can prep the site through the use of multiple series of pilot drills. We prefer BioHorizon in this office. So that is our implant system of choice. There are many, many different systems depending on the office, depending on the dentist or the surgeon's skill and their training. They have a system that they're comfortable with and they have expertise in. But for us, we like BioHorizon. We find that it's a great product and they give us everything that we need and it's easy to restore. After the implant is placed, a lot of times we may either place a cover screw and we will bury the implant and give you some stitches. Or if we can, we like to place a healing abutment on top of that implant. That healing abutment is going to be visible above your gums so that your tissue can form around the implant so that we can get, as we start to restore the tooth, we have that real natural, unique appearance for that crown. So you can't see that there's any defect or know that you have an implant there. After the procedure, for some people, especially if you're missing a tooth in the front, we'll give you an Essex retainer, which is like a little clear liner, and we either put an old crown, if you had a crown on a tooth that we're removing, or we'll put it like a resin or tooth color filling material in that area, just so that when you smile, you're not worried about, oh, I'm missing this tooth, it doesn't look good, people are gonna notice. From a distance, people can't even tell you had anything done until you heal. For implants placed in your upper jaw, it takes about 4 months for the implant to integrate into your bone before we can restore it. Implants placed in your lower jaw, it takes about 6 months. So once you have healed and you've come in for a series of post-op visits to check your wound healing, make sure the implant is integrating, we'll uncover you using our laser. We have a water-lace BioLace laser that we use in office. So it's atraumatic as possible. We're not trying to lay any additional flap. We want it to be painless. We don't want to have to add any more additional stitches to you. So we will uncover that implant. We may place the healing abutment, but at that time, we're ready to scan you or take an impression for your final prosthesis. So if that's an implant crown, we're scanning you for that crown. If it's for an implant bridge, we're scanning you for that bridge. If it's for a hybrid, that is a little bit of a different process, but we still are gonna scan you. We've come up with your smile. We've communicated with the lab. We're ready to start making that prosthesis for you at that time. After then, it takes about 3 weeks, like it would for any normal dental work, to come in. And then we'll call you back in and we're ready to deliver that final prosthesis. We numb you up a little bit. We insert the prosthesis. I do mainly screw retained, meaning that the lab sends me back a crown and an abutment in one piece and I just tighten it into the implant. We check your bite, we fill that hole, and you're ready to go, like with your brand new tooth, your brand new smile, and you can't even tell that you ever had anything done. After your implant procedure, after every step of your implant procedure, we're gonna give you explicit home care instructions. We want you to follow those to the best of your ability. That may mean avoiding eating on a site. That may mean that you need to place a gel in your mouth multiple times a day to help with wound healing. It's definitely going to involve you cleaning your mouth multiple times a day, making sure the site is clean. We want to make sure we're not placing any additional pressure on that implant site or the bone graft site, because we really want to give your body the best chances of integrating that bone graft or implant so that we don't have any higher risk for implant failure. As far as your regular maintenance, you want to go back and see the person who placed your implant at least once a year to make sure that it's still doing well, and that's integrated and it's not failing. You want to make sure that when you go to the dentist, every 6 months, you're having your cleanings done. You want to make sure that you're brushing and flossing at home every single day. An implant is an investment, and we want you to have that investment for a lifetime. So if you do your part and we do our part, it can last for forever. If you are interested in a dental implant, whether we are just replacing one tooth or you would like to bite into an apple and feel confident about your smile and we're replacing a full arch, please consider giving Bellissima Dental Boutique a call. You can call to schedule a consultation with us at 910-778-1229, or you can visit our website at www.boutiquedentalandimplants.com.